Welcome back, everyone. We all get a little ache and pain here and there, but there is some pain that should never be ignored. My next guest is here to shed some light on an all-natural, non-surgical solution for knee, shoulder, and hip pain. Please welcome back to the show, Dr. Ross Carter. Welcome back.
Thank you very much for having me.
Love it. All right, tell me all about this book. Congratulations.
Thank you very much. Well, we decided to create a book because there's a lot of controversy when it comes to stem cell therapy.
Yes.
So I wanted to make a book that broke it down to explain what stem cell therapy is and what it isn't. So I made a very easy to read book that explains all about stem cell therapy and what it does.
Right, and talk a little bit about what it actually does, because I've heard it in so many different applications to help us improve our health.
Yes.
And today we want to talk about getting rid of pain.
Absolutely. Well, stem cells are the master cells of the body. Stem cells are there to repair and replace all the damaged tissue and cells that die. So basically what we do is we are using stem cells to regenerate the damaged tissue. So that's really what a stem cell is there for. The problem happens is as we get older, the amount of stem cells and the ability of those stem cells decrease dramatically. For example, by the time we're age 30, we've lost about 95% of the stem cells in our body. I know.
That's not good.
No, it's not. And as we get older, it gets worse and worse. So when you lose that many stem cells, you're more prone to injury and degenerative conditions. The purpose of our treatment is really to reverse that process. We're trying to regenerate the body, give it healthy new tissue, and eliminate the pain.
Okay, are there different types of stem cell therapy then?
Yeah, well, back about 25 years ago, people heard about embryonic stem cells.
Right.
Well, that is not even legal or used in the United States, so you don't have to worry about that. There's been advances in stem cell therapy since then. So the two primary legal stem cells are one is adult stem cell and one is placental tissue. Now, an adult stem cell is where we actually use either bone marrow or fat. So there's a minor surgery that's performed. We take the bone marrow or the fat out, we spin down the stem cells, and we use that.
It's incredible.
It is. But the problem with doing that is there's a surgery involved. So there's been advances since that's been created, and now there's placental tissue. It's an allograft. Basically, a healthy woman donates her placental tissue to a laboratory, and then they can use that healthy tissue to get the stem cells from it. And so that's the primary way. And there's no surgery involved, which is so amazing.
Incredible.
And so there's no chance of infection and stuff like that. So it's a fantastic alternative to the surgical procedures.
All right, so getting back to the joint pain specifically,
yes.
Because a lot of people, whether it's a sports injury or we're just getting older and you were at the gym and somehow you've got this nagging pain, how do stem cells really help in aiding you to get back on the road to recovery quickly, efficiently?
Yes, well, there's three areas that it works. First, it's a natural anti-inflammatory. So basically, when you have pain, it's due to inflammation. Stem cells are a natural way to eliminate that pain response. So it's a natural anti-inflammatory, kind of like a cortisone shot, but it doesn't have all those side effects. The second thing is it's tissue regenerative. It can actually create healthy new tissue. And I want to show you a graphic of an x-ray of a patient of ours that actually had this done. Now you can see on the left, you can see that the middle part of that knee has degenerated considerably. This person had knee surgery and they scoped the knee. Well, they removed that meniscus and then it caused this bone-on-bone situation.
Oh, yes.
So we injected stem cells in this joint. You can see on the right-hand side that the tissue is actually regenerated. So stem cells can actually regenerate healthy, usable tissue.
That's incredible.
Yeah, it's fantastic. And the third thing is that it's anti-fibrotic. And what's important about that is when you cut yourself, you create a scar, and it's scar tissue. It's not the same usable tissue. Stem cells actually create healthy, usable tissue as opposed to the scar tissue. And it can reverse previous scar tissue that's already there. So it can reverse scar tissue and it can create healthy, usable tissue. That's really important.
And then how many treatments are needed? Does it just depend on the situation?
It does, but typically most of our patients, it can be done in only one treatment.
Wonderful.
One treatment is
results quickly?
Yeah, typically the results are around 2 to 4 weeks. And the tissue regeneration is typically 2 to 6 months of time, but the pain relief is about 2 to 4 weeks because of the anti-inflammatory component.
Sure, sure. And then what would you say makes Stem Cell of Atlanta really so unique?
Well, I'll tell you, I think we're the best, and I'll tell you why. Number one, our doctors are second to none. Our doctors that do the procedure are double board certified. They're anesthesiologists as well as pain management. So they are double board certified. So we have the best doctors to do the procedure. And that's very important because a lot of offices that do this procedure are using a nurse practitioner that learned it over like a weekend.
Right.
Our doctors are specialists. Number two, we use a state-of-the-art surgical facility. This is not done in the back of an office.
Right.
This is done in a surgical center, state-of-the-art. We use a big C-arm, which is a video x-ray, so you can make sure that the product is getting right where it needs to because
very
it's
precise.
critical. Some doctors use maybe an ultrasound or they'll just guess and they'll just, yeah.
No,
and you got to be careful of that. There's doctors that'll do that, unfortunately, or nurse practitioners. And the third reason is because we have what's called our $6,000 satisfaction guarantee. Nobody offers this. Because when somebody comes in and does a procedure like this, they're concerned, well, is this going to work for me? And if it doesn't on some places, then, you're out of luck.
Right.
But with us, we have a $6,000 guarantee. And what that means is this. If you do a procedure in our office and say 3 months down the line, you're not getting improvements, and we get about 85%, so it's good. But if we don't have improvements, then we will actually pay to have the procedure done again. We'll pay up to $6,000 to do the procedure again. We'll cover the cost ourselves.
That is wonderful.
And no one can beat that offer.
Now, would you say insurance covers this at all? Or, what? Because I know a lot of people out there, that's the first thing they're thinking.
Sure, of course.
Cost-wise, insurance.
Cost and insurance. Well, let's go through that. The cost is really based on what needs to be done. There's different types of procedures. There's different types of joints that need to be done, how bad the joints are. So it's really based on that. But the average can be around $1,000 to $6,000. But, we don't want the finances to stand in the way of somebody getting better. So we offer finance options to help out everyone.
Right.
Now, unfortunately, insurance is not there yet. It doesn't cover the procedure. So Medicare, Medicaid, Blue Cross, none of those cover this insurances cover the procedure as of this moment. So, yeah, that's why we offer financing. And
yes, I mean, it sounds like such an amazing facility helping so many people. And I know you have a great offer for Atlanta and Company viewers who are listening.
Absolutely, absolutely. Our offer is basically this. We need to find out if stem cell is right for you. Everybody's different. And we offer a free 20-minute consultation over the phone. You don't actually even have to go get into your car and go to the office.
Yeah.
We'll talk to you on the phone for 20 minutes to find out if this is something that is really right for you. And if it is, we'll offer you a free a joint treatment. We'll give you a 10% off of one. And if you do 2 or more joints, you'll get buy one, get one half off. And we'll give you one of those books as well.
Good.
Yeah, absolutely. And I've actually brought a testimonial of one of our patients that came in for the procedure, and she can explain a little bit more about what her experience with the procedure.
Awesome.
For about, I guess, 3 or 4 years, I've been having really bad problems with my knees. Came here, got the stem cell shots, and I'm not kidding, within 3 to 4 weeks, I feel like I'm my age, if not younger again. I can move up and down the stairs at will. There's no grabbing. I can even carry things up and down the stairs. It's absolutely thrilling, and I can't wait to see if I can run as well as do some hiking again. And I feel very confident in moving. Very happy.
That tells the story right there.
Exactly.
There you go. Doctor, thank you so much for coming back.
Thank you for having me.
If anybody is experiencing any kind of joint pain, this just seems honestly like a no-brainer. Get the help you need. Get back to feeling good finally, once and for all. If you want to learn more about that great offer, head over to the website, stemcellofatlanta.com, or give them a call, 770-728-6522. And this segment was paid for by Stem Cell of Atlanta. All right, coming up, we're sharing an easy project that can instantly improve the look of your home. We'll be back.